Good afternoon, everyone. My name is Claire Verbaeten. I represent District 66 in the Minnesota Senate. I also serve as an Assistant Senate Majority Leader and the Vice Chair of the Senate Judiciary and Public Safety Committee. More importantly, I am the Senate author of the bill to fund crime victim services, which is why we're all here today. And we're at really a critical crossroads for these services. During the last biennium, the DFL-led legislature worked tirelessly to invest tens of millions of dollars into crime victim services. And now the Trump administration's funding freeze has cast a cloud over our progress. Despite a temporary block from a federal judge, many of the critical funds meant to support survivors are still frozen. This is a direct threat to victim services, and it cannot be ignored. As someone who has fought for the crime victim services and who is, again, proud to be the author of the bill that ensures these services are adequately funded, I can tell you that we're honestly facing a crisis right now. These services, the shelters, hotlines, legal assistance, counseling are essential lifelines for survivors of domestic and sexual violence. And without proper funding, Minnesota's victim services will be forced to make devastating cuts that will look like staff layoffs, reduced programs, and closures that are already looming on the horizon. I want to be clear that this freeze impacts real people. It impacts families and communities across the state. Our survivors are in desperate need of support, and when they reach out, they should not be turned away. So many of us have been personally impacted by domestic and sexual violence, whether as survivors ourselves or as loved ones of those who have survived. Just a few weeks ago, I attended Violence Free Minnesota's Intimate Partner Homicide Memorial, where we honored the lives of those tragically lost last year. These people are not statistics. They are real people, our neighbors, our friends, and our families. We cannot allow these cuts to continue. I want to stand here with advocates and survivors across Minnesota to demand action today. We need to ensure that the programs that save lives can continue and do so without interruption. Thank you, and I will pass it to our amazing House author and chair of the Public Safety Committee, Representative Kelly Mueller.
Thank you. And before I begin, I'll just say that Attorney General Ellison sends his regrets. He is ill today and unable to join us. I am Kelly Mueller. I represent District 40A, Arden Hills, Mounds View, Shoreview, and New Brighton. As Senator Verbaeten said, I'm the DFL lead right now of the Public Safety Committee, and I'm also a long-term prosecutor. Federal funding that Minnesota receives for victim services is crucial to public safety. In recent years, that federal funding has been decreasing, and now the Trump administration's attempt to freeze federal funds and the chaos and uncertainty surrounding the victim funding that he has created has made what was already a crisis in Minnesota a 5-alarm fire. It is important to understand what is at stake here, and Senator Verbaeten so eloquently described the real humans behind these cuts and how that impacts them, but I am also going to give you some numbers here. CDC data indicates that 1 in 4 women will experience physical violence by an intimate partner, and about 1 in 3 women will experience some form of sexual violence in her lifetime. Men and boys also experience domestic violence and sexual assault. Many domestic violence and sexual assault crimes are not reported to law enforcement, yet advocates are still there to help victim survivors. The types of services provided to victims in Minnesota include domestic violence shelters and advocates, sexual assault advocates, assistance to victims of all crimes, safety planning, child abuse centers, and connections to housing and resources and other services, including those that are culturally responsive. These services are critical for keeping victims and their families safe, and they are essential to public safety in Minnesota. Funding for victim services in Minnesota has primarily been through the Federal Victims of Crime Act, also known as FOCA, which is financed by fines and penalties from convictions of federal cases. The fund has been unsteady in recent years, and the fiscal year 2024 VOCA grant to Minnesota was a 42% cut from 2023. In 2023, as we put together the state budget, we were under the impression that the federal decrease to VOCA was temporary, so we shored up funding to victim services with mostly one-time funds to account for that decrease. At this point, it is unknown how much VOCA money, or if any at all, will be available in Minnesota for victim services. And on top of that, other federal funding sources are uncertain. For example, some funding comes to Minnesota from the Violence Against Women Act. When the Trump administration froze federal funds, that included Violence Against Women Act grants. And although attorney generals have been successful in lawsuits to put these freezes on hold, as of this morning, the Office of Violence Against Women website says, quote, fiscal year 2025 open notices of funding opportunities. At this time, OVW has withdrawn notices of funding opportunities, and you should not finalize any applications started under them. I'm also told that federal funding for the Victims of Child Abuse Act is still on hold. In addition, partner programs being unable to draw down committed funds like those related to housing or immigration also put these other programs in jeopardy. The decrease of VOCA in recent years and the uncertainty of any federal funding for victim services coming to Minnesota makes it very difficult for programs working with victims to budget and to stay afloat. While we're exploring options for boosting state funds to these programs, we'll have difficulty covering the full federal gap. And if these advocacy programs close, Minnesotans will be less safe. We do have providers here from all over the state, and I want to thank them for coming, victim survivors as well. And next up, you're going to hear from the Minnesota Coalition Against Sexual Assault.
Good afternoon. Thank you all for being here today. My name is Kenosha Alexander, and I serve as the Interim Executive Director of the Minnesota Coalition Against Sexual Assault. MNCASA is a statewide coalition driving transformative culture change to address sexual violence through advocacy, prevention, racial justice, and systems change. MNCASA has more than 60 member programs that offer advocacy and supportive services to victims of sexual assault. We're here today to speak about a crisis that is unfolding in real time, one that threatens the safety, dignity, and well-being of victims and survivors of sexual violence across Minnesota. The recent federal funding pause implemented by the current administration has placed rape crisis centers, advocacy organizations, domestic violence shelters, child advocacy centers, and other victim service providers in an impossible position. These funds are not just numbers on a budget sheet, they are lifelines. They provide critical support for survivors seeking emergency assistance, counseling, legal advocacy, intervention, crisis intervention. Without them, services are being scaled back, wait lists are growing, and too many survivors are left without the help they desperately need. For decades, Minnesota's rape crisis centers have worked tirelessly to serve their communities, often on shoestring budgets, relying on federal grants to sustain their life-saving work. This funding pause disrupts our ability to do that work. It forces difficult decisions, whether to reduce staff, limit services, or in some cases, shut down entirely. The burden of the crisis does not fall on the organization alone. It falls on survivors who already face countless barriers to justice and healing. We need lawmakers to make immediate action to ensure that services for all crime victim service providers remain accessible to all who need them by restoring funding and establishing a long-lasting, sustainable solution. To our community, our partners, and our advocates, we need your voice now more than ever. Speak out, contact your representative, demand that funding for all victim services is not just reinstated, but made a permanent, protected priority. Survivors deserve better. We will not stop advocating for them, and thank you.
Hello, I'm Jen Paulzine, CEO of Tubman, one of 90 domestic violence organizations that are in every single part of the state of Minnesota that help victims become survivors. In 2024 alone, domestic violence programs served 70,000 Minnesotans. These are not just statistics. As we've heard, victim survivors are humans. They're our family, our friends, our neighbors. We are also your community leaders and your workforce. Organizations like Tubman provide 24/7 crisis hotlines, safety planning, shelter, longer-term housing, legal services, including orders for protection and attorney representation, mental and chemical health counseling, youth programming, including violence prevention education, and counseling with people who have used violence in order to help break the cycle. We're all here today to address the urgent crisis that is facing survivors of domestic and sexual violence in Minnesota and all crime victims. An issue that, as we've heard, affects at least 1 in 3 women, 1 in 5 men, and up to half of trans and non-binary people in their lifetimes. We've heard about federal cuts to the Victims of Crime Act that are threatening the stability of services available to survivors all across our state. And we've been bracing for an additional 42% cut this year. The recent threats by the federal executive branch attempting to freeze payment on all of those services that we are contracted to provide makes the short and long-term sustainability even more drastic and would have a devastating effect on public safety and public health. We've heard about the longer wait times for crisis intervention, fewer beds and shelters, increased homelessness for victims, and even more limited access for legal assistance. But we know that some programs will indeed be forced to close their doors altogether, as Kenosha stated. While rural, suburban, and urban communities alike are all facing the devastating effects, we know that culturally specific and rural programs will be especially hard hit. For example, in many areas, there is only one advocate serving an entire county, which means that if this funding is frozen, entire swaths of the state of Minnesota will not have any services available whatsoever. And the most vulnerable, children, Indigenous women, people from other marginalized identities, will bear the heaviest burden. We cannot allow these cuts to push survivors into increased danger and isolation, so we call on our entire community and our lawmakers to take immediate action, oppose the federal funding freeze, restore critical funding, and establish lasting, sustainable solutions for these life-saving programs. We know that safety is not a privilege, it is a basic human right, one that our leaders must protect with urgency and conviction. We're so grateful to those who are standing with us today. Minnesota has always been a leader in supporting survivors, and now more than ever, we must protect these essential services. Our community demands it. Thank you.
I think we're ready for questions.
I noticed the dollar amount in the current bill language is blank for now. Are you guys waiting for a little bit more clarity on the federal funding freeze to make up that number? Is there like a dollar amount you guys are seeking right now?
I think before we do anything else, we'll get the budget forecast. Typically, it's not uncommon to have those appropriations blank until we have a little bit better idea about what the state budget forecast is.
Do you have any idea how much exactly, though, in terms of federal dollars are being withheld that you were expecting? And also, we're hearing that this goes way beyond this freeze and then the court ordering it to be unfrozen. We're hearing that this goes way beyond that these monies are still there. How widespread, does anybody have any idea how widespread this is across the government?
I'm going to give you the big picture, and then we'll have some of the experts describe it in more detail. So the VOCA funds are separate from some of the other funding sources, like the Violence Against Women Act fund sources. And a lot of programs here apply individually for those VAWA funds, so they don't necessarily flow through the state. So we're aware of more of the funds flowing through the state that get allocated, but those that go to direct programs, I don't have an estimate for those numbers. And I know there's some real-life examples here that people can give.
I can share with you that Tubman, just one of the organizations here today, our federal funding represents about 29% of our annual budget, and we serve 18,000 people every year. So a third of that is a big loss to thousands and thousands of survivors that just one organization serves.
So how much exactly is that, and when you get in your account in January or February or?
So for most of those funds, we do the work and then we draw down and get reimbursed for the work. And so some organizations here today are in the middle of a multi-year funding cycle. Some are just about to reapply for those opportunities that now have been taken down off federal websites. So each organization is in a different timing cycle.
How much are you out right now?
Right now, we are poised to be out about just over around $3 million.
$3
$3
million for,
million plus an additional 1.2 that will be coming if the freeze continues longer.
$4.2 million in total, and I'm sorry, just is that for how many years? And just the work that's already been done in North Park?
So that is, we bill as we spend the dollars, and so we parse it out over the period of time. So within this current budget year, it's the first number, so it's about 3, and then it's additional for additional cycles as time continues on, if that makes sense. We are all contingency planning, and again, we are just one organization of the, nearly 100 organizations that these coalitions represent. We are all contingency planning as fast as we can. Yes, please.
Good afternoon. My name is Guadalupe Lopez. I'm Executive Director of Violence Free Minnesota. We heard from the coalition and Mincasa, and we also heard from a member program that does direct services. I just want to speak a little bit about what Coalition does. Coalition does research-based work. We do policy work. We would do social and systems change work, public awareness around any types of violence, education and training, technical assistance to the boots-on-the-ground survivors. VFMN is around 80% federally funded, and if we dissolve. And there's also national TA providers who do this work, who are constantly making social and systems policy changes on national levels all across the United States and in our territories and in our tribal nations. And those are majority federally funded. If those dissolve, the social systems change aspect of the work that we do, so many people have tried to do this work, is going to dissolve, and it's not going to have anything to, we're going to start from square one. And I'm also thinking of the way that this field, there's so many people in this field that touch the lives of survivors. Imagine what that's going to do for all the United States and our state territories and our tribal nations. It's going to impact and implode in so many different, our law enforcement cannot keep up with it. Our medical, our child systems cannot keep up with the work that we actually touch on a day-to-day basis. So, thank you. I'm sorry.
Can we hear a little bit about how difficult it is to, I guess, plan and account for work hours when you're unsure when and if this funding is going to come in?
How long do you have? Who's going to answer that? Someone.
So for children's advocacy centers, what it means is, as was said previously, that there may be one advocate that serves an entire county for child abuse victims and their families. They may be serving 2 or 3 counties. So eliminating any kind of funding eliminates that kind of service. They also provide forensic interviews that are assistance to law enforcement and child protection. Without forensic interviewers, those children would be interviewed by law enforcement officers, perhaps at a police station. I know that our children's advocacy centers in Minnesota, there are 13, and there's a regional center, and then there's our coalition. The regional advocacy center and our children's advocacy centers are going to lose $4.5 million. And I know that our coalition is funded 90% by federal funding. And right now, we're looking at things such as how do we keep staff? What can we eliminate in our coalition? Just as a concrete example, we're looking, our lease is up, and they want us to sign for 3 years, and I had to decide, no, we're not going to have an office, because that's just poor business when we don't know what's going to happen, which decreases on training, technical assistance, and other services.
And so that uncertainty, I mean, it would be different if you knew the funding was for sure not going to come.
Right.
But sort of, with the courts involved in this and the uncertainty of this, I mean, how do you approach that from a business standpoint? Do you dial back immediately? Do you wait to see what happens?
I think everybody is doing, figuring out what works best for them. I know for the Children's Alliance, we have started dialing back immediately to ensure that we are not overextending ourselves in any way. So we are planning as if our funding is going to be cut.
I just have a clarifying question, and I'm not sure who would want to answer this, but a lot of this conversation is about the future of certain funding, but I just want to clarify, are there funds that are currently frozen?
Yes.
Okay.
Yeah, let's talk about those.
I was gonna just say it to that point too, that so much of this funding is reimbursement based, so folks are doing this work right now, and now they're not getting paid. And how can you survive when you've had that contract, you've been promised those funds, and they're not coming? Even if, we're gonna be loud, and we're gonna be pushing for getting this funding that was appropriated to the services. But even if they come back later, that could be too late, right? We need the funding right now that we were promised, and our advocates cannot access it because of the Trump administration.
Not just with this issue, but I'm curious for the lawmakers, what are you hearing from Republican colleagues on the federal funding and its impacts in general?
Well, when we bring up the federal freezes in committee by the Trump administration and Elon Musk, and talk about what a devastating impact it will have in Minnesota, it is having in Minnesota, and particularly in the Public Safety Committee, we are met with laughter. I think there is a view that we're overreacting or we're hysterical about this. We're not overreacting. This is serious. Programs have already started to make changes. So I will say that I know my colleagues on the other side of the aisle do tell me they care about victim services. My bill is bipartisan, but when we do bring up the cuts from the federal level, we're met with laughter.
Is that the same in the Senate?
I would agree that we've heard a lot of calm down, we're not sure what's happening, and, our advocates are telling us, I cannot access this funding right now. We're not gonna be calm about it. Of course we're panicked. There's services that people desperately need and can't access. So, I think that's ridiculous, and I hope that our Republican colleagues will stand with us and will demand that this funding come right now.
Thanks a lot.
Yeah,
Yes.
are any of these, and this might be a question for the organizations, but are you given any notice of these funds changing, or is this something you just find out about when you try and access those?
Sure. My name is Artika Roller. I'm the Executive Director of Cornerstone Advocacy Service. We're located in Bloomington. And I think that we were notified on a Monday, and funds stopped the next day at 5 p.m. We have a transitional housing program that is totally funded by federal dollars. In addition to that, we have a partnership with another organization called Think Self. We provide dual advocacy under a federal grant for underserved populations that serve deaf and hard of hearing individuals. That funding will stop and go away. So it's short notice. We're not getting a week or 30 days. And again, as everyone else stated, we've already done the work. We're asking to be paid for the work that we've already done.
Final questions? Thank you.
Sorry, no. We've heard a lot from the coalitions about how this is impacting the coalitions themselves. Can we hear a little bit more about how it's impacting direct services organizations, the ones who are answering the crisis lines, going to the hospital for survivors? How is that impacting them?
I think it's impacting us in every possible way about reduced hours. The amount of time spent doing all of this contingency planning rather than providing direct services is absolutely extraordinary. I will also share that we are hearing the impact that survivors are facing every single day because part of it is about confusion, misinformation, uncertainty, and chaos. And so what's happening is, for example, survivors that we work with in our housing program are about this close to signing a lease with supportive services provided by us as service providers and in partnerships that we've worked really hard to build with property managers and landlords who are saying, we can't do this because of the federal funding freeze. We can't take another resident who is having some rental assistance through the federal government right now. So even for those that are, some had move-in dates that have since been bumped, and that's just in one aspect of their daily lives.
Thanks, everybody.